ChatGerry, Post-Stroke and Diabetes Medication, Understanding Trends Before Numbers Look Abnormal, number 1520, BPTO77, the 1st of February 2026, Gerald C. EclaireMD Foundation, category, Stroke and Diabetes. Preface: I am writing this for stroke patients who also live with diabetes. This is not a paper written for medical publication. It is a patient story. Based on my long-term data and lived experience. My goal is simple. I want to help patients notice early warning signals before lab numbers look abnormal. Introduction: After my stroke on June 21, 2025, I learned an important lesson. Numbers alone do not tell the whole story. Direction matters. Trend matters. How your body responds over time matters more than whether you are just above or below a medical cutoff number or threshold level. Doctors often look at lab-tested values. Patients live inside their bodies and feel when something has changed. This article is written for patients, not doctors. It is meant to help you listen earlier. My baseline before stroke: from 1991 to 2009, I controlled my type 2 diabetes by medications alone. From 2010 to mid-2025, I took no medications at all, no diabetes drugs, no supplements, not even vitamins, for more than 16 years. I controlled my glucose entirely through lifestyle habits such as food portions, carbohydrates and sugar intake grams, walking steps, and daily routines. During that time, my body responded well. When glucose went up, lifestyle changes brought it back down. That meant my body still had reserve. What changed after the stroke? After my stroke, several things happened at the same time. I became tired more easily. I could not walk as much. I needed more sleep and rest. My glucose became harder to control. Weekly glucose swings increased. These were not choices. They were signals from my body. Pushing too hard would have caused harm. Recovery is not about forcing your body to perform like before. It is about learning what it can safely do now. Metformin after the stroke. I started metformin only after my stroke. At first, a higher dose lowered glucose too much. When I reduced the dose, glucose rose again. When I increased it back, glucose still drifted upward. This was confusing at first, but the data became clear. The medication did not suddenly fail. The system changed. Exercise was weaker. Reserve was lower. Medication effects became more noticeable. Why weekly glucose changes matter? After the stroke, my weekly average glucose fluctuated more than before. These changes followed medication adjustments more than diet or exercise. My diet stayed mostly the same. I even reduced meals from 3 to 2 per day. This is an important signal. When lifestyle tools stop working as before, it does not mean failure. It means reduced reserve. What feels like randomness is often structure changing underneath. Why thresholds can mislead. Many patients are told not to worry as long as glucose stays below cutoff such as 114 mg DL or HbA1c 5.7%. I stayed below those values, yet I was still concerned. My glucose showed a slow upward drift and became harder to bring back down. Trend matters more than a single number. It is like driving uphill. You may be under the speed limit, but the engine strain tells the truth. The real issue: loss of reserve. For my stroke, my body could handle stress and recover. After the stroke, recovery became slower and sometimes incomplete. This is called loss of reserve. Common signs include needing more sleep, getting tired faster, slower recovery, and glucose reacting more strongly. These signs often appear before lab values look abnormal. What my analysis showed: in simple terms, I analyzed my post-stroke data over 7 months. The results were clear. Sleep became the most important factor for glucose stability. Physical activity still mattered, but was limited by fatigue. Food control mattered less than before the stroke. This means post-stroke glucose control follows a different structure. Managing diabetes exactly the same way as before stroke does not work as well. Conclusion: my post-stroke experience taught me that diabetes management cannot be judged by numbers alone. Staying below a cutoff does not guarantee stability, especially after a stroke. After stroke, the body changes. Reserve is lower. Sleep needs increase. Recovery slows. Medication looks different because the system is different. This article is not meant to replace medical care. It is meant to give patients language for what they feel. The body is a moving system. When its direction changes, listening early is wiser than waiting for numbers to cross a line. Calm attention allows safer recovery. That is the message I hope other stroke and diabetes patients can take from my frightening experience. Checklist for stroke patients. 5 daily body signals. 1. Gas tank. Are you running out of energy earlier than before? 2. Bounce back. Does it take longer to feel normal after fatigue? 3. Sleep is medicine. An extra hour of sleep may help glucose more than extra walking. 4. Do not force it. Stop if you feel dizzy, weak, or unusually tired. 5. Watch the pattern. Do not worry about one reading. Be concerned if glucose trends upward for a week. The golden rule: if your body feels wrong, it probably is, even if lab tests look normal. Disclaimer: I write this paper not for fame, but to share what I have learned so others can understand health, prevent disease, and live longer, healthier lives. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered or republished as your own. All intellectual property rights belong to the author, Gerald C. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to the author, Gerald C.